difficulty that doctors have in converting patients into, or potential patients, people who need treatment, right? I mean, correct. I mean, I have a tendency to say the word sell, and the truth is that, you know, we need our staff to be salespeople, because at the end of the day, we are selling procedures now, right? And we've talked about this. I mean, the world of dentistry, when I came out 35 plus years ago, was a healthcare profession.
Mm-hmm.
Now it really is a customer service,
Yes.
right, profession, and the product we sell are dental services. And at the end of the day, you know, and again, as I say, and when I teach, a lot of times we talk about marketing and we talk about, you know, looking at your Google reviews and what do you see when you read them. It's not about, oh, Dr. Cohen was so wonderful, or, you know, whatever, he was so gentle. You do see that, but nowadays, people are relaying the experience they had, right? It's about the nice staff. It's about, you know, made to feel comfortable. And it's their experience that they're relating to now.
Mm-hmm.
And so one of the things that's really important is when we're selling that need, because we have to sell that need, because we have to educate those patients. The problem becomes, you know, doctors especially, really, really bad at speaking about money.
Oh my God, yes.
Like terrible. And they're always afraid that they're going to overprice, and so they undervalue themselves. And one of the things that's so important, and I mean, I think we both espouse this, is the idea, listen, commit to being the best you can,
Mm-hmm.
use the best product you can, because at the end of the day, you're giving patients the best outcome in the end. And that's what patients are going to want, right? They want that superior experience. They want to know they're getting quality, and they want to know they have a good outcome. At the end, the business will grow from that, right? Mm-hmm. But all too often, we're just so afraid, and we don't want to talk money, and we don't, you know, we're afraid that we're going to scare a patient away. And so we undervalue the service that we're about to provide. And that's a problem, because the minute you do that, it's like you already now have laid that seed of doubt within the patients as well. Well, do I really need this?
Yeah. No, it is important for us to learn with the retail, right? I think now, it's like what you said, we are seeing consumers, less patients.
Yep.
If I think of my first dental experience, that was a patient-doctor experience.
Yeah.
And I was 4 years old. I went pick it up. My sister, wasn't my time. I said no. And Mom, get outside, lock the door, open your mouth, and let's get your teeth clean. If we do that these days, is impossible, right? And I think something that we have learned, and that is the retail mentality. We have to have that consumer experience. One thing that you wanted is to advertise what is the person that you are also. Sometimes we do place beautiful smiles, like before and after, and it becomes very sterile. We needed also to understand hours of your, now that you're working, has to be extended. Right? We used not to work Saturday, Sundays. Now it's almost it's
about
a necessity.
Convenience.
Yeah, it's about
convenience.
Getting to that. I want you to be relatable to me. So when you start talking about money, most of us feel uncomfortable. So hire someone who comes from the retail aspect, who it is comfortable to connect with the patient in a human level, and then stay clinical. If your strength is not talking about money, stand where you are, confident into your clinical skills, set your pricing, and let your team do the rest. You know, put yourself with a winning team and build that pattern, and you're going to see a change into the philosophy and application of treatment.
There are really two different groups, two different demographics that we need to appeal to, and they have very different needs. We have the experienced doctors, the ones who are already out there, but then we have those new grads, right? The 0 to 5s, I like to call them. And at the end of the day, those 0 to 5s are coming out of school, not at the level necessary to deliver a lot of the treatment that is available to patients that patients are expecting today, right? They don't have the experience with technology. They're not prepared to do myofunctional therapy, orthodontics. They're not given even the most basic skill set necessary to really provide that kind of care, which it is the standard of care. You know, one of the things that's really important for those students is to really immerse themselves in education, immerse themselves in mentorship, take the kind of things where they develop and understand that they need to crawl before they walk, before they run. And that, you know, you need to be selective and you need to find the support so that you can be good, because it is a long race.